Hi, I'm Alfred Atanda, and I'm a pediatric orthopedic surgeon that specializes in sports medicine. And this is my first go round at a video blog. I have been in the digital health, telehealth space for about 4 years now, and I do have a lot of ideas and things that I'd like to share and spread about how healthcare could potentially be improved. One of the things that I've noticed just in my clinic life here in the hospital is how um, we in healthcare um, are not really providing our patients um, with exactly what they need and with what they want. We anticipate that we know what they need and want, um, but I've noticed that we're not doing a very good job at that. For instance, I'm a sports medicine surgeon and I see a lot of patients with knee pain, and we assume that the patients are there because they want their knee pain fixed, and that's the sole reason that they're there. So we work them up, we evaluate them, we investigate their knee pain, um, and when we come up with a solution, we anticipate that we're going to solve their problem and they'll be happy. But I did get kind of an eye opening glimpse as to how this is inaccurate by examining what we do in our hospital cafeteria. I know that sounds strange, but when you look at people in the cafeteria, if you assume that everybody was there because they were hungry, then you'd probably be making a lot of wrong assumptions about people. Now, I tend to go to the cafeteria a lot, but for a whole host of reasons. Uh, One reason, obviously, would be to go and get something to eat. But sometimes I go there because I'm thirsty and I want something to drink. Sometimes I go there because I'm walking and I'm talking with somebody who's going to the cafeteria, so I just go there with them. Sometimes I go to the cafeteria because I need a place to do some work and to kind of veg out a little bit, so I go sit at the tables or I go sit outside. Sometimes I need a plate, sometimes I need a fork, sometimes I need other utensils, maybe condiments. Um, Sometimes I'm looking for somebody. Somebody may have told me that, hey, I'm looking for one of my colleagues, and I heard that they were in a cafeteria, so I went there to look for them. I know these are very silly analogies, but one of the things that would be very silly would be to stand at the opening of the cafeteria and be just giving out cheeseburgers or giving out slices of pizza, assuming that everybody who is coming there um, is hungry. And that's kind of what we do in healthcare. And as a sports medicine surgeon, for years, I've always assumed that everybody who shows up with the same complaint is there for the same reason. So why not evaluate everybody the same and get the same x-rays and ask the same questions and do the same physical exam findings and just assume that you're going to solve everybody's problem. And I think that that's been an issue of mine and maybe a lot of other providers in healthcare. When I look at my population, I find a whole host of reasons why people may be there. As a specialist, a lot of people go and see their primary care doctor or they go see their urgent care physician, and they tell them to come see an orthopedic surgeon. So somebody just comes because that's what they were told to do. Some people need to see an orthopedic surgeon because they've been having some knee issues or ankle issues, and they've been having some pain, and their gym teacher wants them to get a gym note before they can be cleared back to playing sports. Other people come because mom or dad is really worried and really anxious, and the kid has been kind of complaining and hobbling along, so they come just to be reassured that they're not letting their child do any further damage to their knee by running around. Some people come because they know that their child is not doing the best for their knee by playing too much or running around too much, and they've been telling their child over and over, but their child won't listen to them, as most children do with their parents, and mom and dad want another adult who is a stranger to tell them what's going on, and then kids tend to listen. What we've also found with parents who may or may not be together is one parent brings the child to the visit, and they tell the other parent what happened during the visit, and they may not be so satisfied. So then the other parent brings the child to the visit. My point is, all chief complaints and all kids with knee pain and all kids with ankle pain can't all be necessarily lumped together. I think as healthcare providers, we do need to take a little bit more time and energy to really figure out why the child is there. Because if you don't do that, what you're going to do is treat the knee pain and assume that you delivered good care, but the child and the parent and the family are going to leave not feeling all that good. And they're going to leave feeling like they haven't been heard, or they're going to leave the visit feeling like they didn't get very much out of it. And then as the provider, you're kind of stuck standing there thinking, well, I did everything that the book told me to do and everything that my training told me to do. But I think looking at people not just as a chief complaint, but more as somebody with experiences, somebody with different interactions, somebody with different goals, somebody with different needs, and really trying to figure out what they're there for, is going to be very helpful in providing valuable care. Now, I know it is hard, and we're not therapists, we're not social workers, we're not there to really delve into people's lives. But with experience and with patience, you can really figure out, that's patience with a CE at the end. You can figure out really what drives people and what motivates people and what their goal is, and what they really want out of that visit in a short amount of time. So I think as you move forward, really think about that and try that out next time in your clinic and see how that helps. I always ask myself, what does this patient want? And how can I deliver it to them in as a safe, quick, and efficient way as possible to get them what they need, and get them on with the rest of their day. That's really all I had to say for this first video blog. Hopefully you'll join in and tune in and hear what else I have to say. Thank you.